Do you think, Dr. Moreira, that taking supplements like vitamin D is enough, or while taking vitamin D supplements is definitely necessary to consume good fat?
I prefer consuming the good fat, and I prefer making vitamin D from the sun. But certainly vitamin D supplementation can be done as well. Most studies, now most, not all, but most studies on vitamin D are studies looking at the vitamin D level and the association of low vitamin D level with disease, whether it's infections or what have you. So, you know, is the vitamin D, because they're looking at vitamin D levels, the question is that vitamin D level just a proxy, or is it really the vitamin D what's making the difference? And I think it's both. I think the vitamin D levels might just be a proxy for health. It's probably indicative of the fact that the person is healthy, that they go outside, that they get the sun, that they have a healthy diet, that they're active. So may or may not necessarily be the vitamin D, but I have seen studies that show that supplementing vitamin D is helpful as well. So it's not just a vitamin D level that's high. It's not just a proxy for health, but it also, I think it can help to do supplementation if somebody has a low vitamin D level. So I think all three are good. I prefer to get it from the sun and from diet, but certainly supplementation is not bad. It can be helpful as well. For the sun, I use an app on my phone that helps me to stay on the sun for adequate amount of time without burning. You know, depending on the time of the year, whether it's cloudy or not, what time of the day it is, but I don't think that's necessary. But, you know, the important thing is to not burn. So I do try to stay on the sun in order to get sufficient UVB rays to make vitamin D, but not to the point where my skin is burning. Okay.
Do you think I guess you're familiar, Dr. Moreira, with the technologies like high-intensity laser therapy, Picard therapy, super-inductive system. Are you familiar with those?
Not really. I don't think I've heard those terms. What I've used personally for myself would be like near laser light or red light therapy, but are you referring to like surgical procedures or no?
I'm sorry, I'm referring to specific kinetophysiotherapy technology.
No, I don't think I'm not familiar with those.
Are you talking about also near infrared sauna therapy?
Yeah, that would include that because it's certainly it's basically using also red light therapy. There are benefits to that, and there are also benefits from using like a dry sauna. I don't have access to either one of them, so I mainly just spend time under the sun. You know, whether one is better than the other, I think that's debatable. And, you know, I've discussed with a good friend of mine the pros and cons of like a finished dry sauna versus doing a infrared sauna. But I have not found either one to have a well-described drawback to it.
Okay.
You know, which one would be best? I think maybe remains to be seen. I think some of the you know, health gurus out there may have different opinions on which one is better.
Good to know. Most specialists in recovering bones, joints, and muscles tend to focus on tissues, but they're neglecting nutrition. How important is nutrition to repair our tissues, bones, joints, and muscles?
Oh, it's extremely important. I mean, just yesterday, I saw an abstract come out, and I couldn't even download the article yet because it's so new, on antioxidants for tendon repairs, for rotator cuff tendon repairs. You know, and I think this study was looking at vitamin C and looking at N-acetylcysteine. But I think that the lab animals where they did the shoulder surgery, they had better integration of the tissue to the bone when they were supplemented with those two antioxidants. but it helps in so many other ways. You know, the issue is when at least in the United States, if you have a car problem and you take it to the mechanic, he'll tell you, well, this part is not doing well. We'll just replace it. You know, whether it's the alternator or the ignition, whatever, they just replace it with a new part. You don't really do that in our human body. You kind of have to work normally with what you have. And if it gets replaced, it gets replaced with dead tissue. You know, you can have an augmentation of a shoulder repair using cadaver tissue. But we don't tend to think that way. And I think our patients tend to say, well, I had this problem, but I had surgery for it and it was fixed. But the problem was fixed using the same tissue that have broken down. And the quality is not any better. You're basically just taking diseased tissue and putting it back to the bone, and that you're hoping that it still heals. And then, you know, we tend to be, okay, so we're going to do some biological augmentation. We'll put some platelet-rich plasma on that repaired tissue. But, you know, it's like trying to add a little bit of biology to the tissue so that it can heal better, but in the presence of a body that is not well nourished. So that's like trying to dry your house after it got flooded, but yet you live in an area where it's raining all the time. You got to have the environment that's going to help you. And I think the environment is really mainly nutrition, particularly when it comes to having adequate amounts of protein, antioxidants, vitamin C, which, you know, is necessary for the synthesis of collagen. So if you're trying to repair a tendon or have a tendon attached to the bone, collagen is important. And for collagen, you know, it's good to have good sources of protein, particularly protein that is high in glycine, and to have vitamin C, and to have a sodium, which is also important for the synthesis of collagen. So, and I think that you know, these are all important. You know, and of course, good nutrition can help prevent an injury in the first place. You know, how to, you know, just kind of deviate maybe a little bit from the question, but you know, how do many of these tendon tears occur? Let's say somebody tears a rotator cuff tendon. Well, what happens with age is that they start losing the elasticity. When we're young, I mean, you could sustain a sport injury, dislocate your shoulder, where your shoulder comes out of socket, and then you put it back in. And the rotator cuff muscles that are surround the humeral head may not be torn because they're elastic. They're elastic and they're able to stretch enough to the point where they're still stretched when the shoulder dislocates. Once we get to our 40s, it doesn't really happen like that anymore. Once you get into our 40s, the tissue becomes more stiff. It's not as elastic. And so if somebody were to have a shoulder dislocation, oftentimes it leads to a fracture because the tendon pulls a piece of the bone out, or it leads to a rotator cuff tear. So the muscles that are surrounding the humeral head and the shoulder, they get torn. So somebody in their 40s who dislocates their shoulder, 40s or older, and they don't have a fracture, I have to assume that they have a rotator cuff tear unless I can prove it otherwise. And how does that happen? Well, particularly through the formation of advanced glycation end products. And, you know, this non-enzymatic reactions where you can get glucose molecules attaching to the tendons make the tendons stiffer, so they don't stretch anymore. Now they just snap. Now, advanced glycation end products happens to everybody, but the higher the sugar levels are, or the higher of the omega-6 you know, acids are, the higher the fructose levels are, then they happen more in those patients. You know, and where do you get fructose? We haven't discussed this, but fructose is found in table sugar. Table sugar, it's a disaccharide of glucose, one molecule of glucose and one molecule of fructose. Well, the fructose itself, it has much higher affinity for forming these advanced glycation end products than even glucose does. And the same thing for the vegetable oils. But even glucose will be a problem. So diabetics with high levels of blood sugar are going to have more advanced glycation end products. And so we see it in the clinic where patients, middle-aged people who have shoulder tendon tears, like a rotator cuff tendon tears, oftentimes will not even give you a history of an injury. It's like, no, I just woke up one day, or, they'll tell you, I was busy working in the yard, and the next day the shoulder was in a lot of pain, but, they don't even recall a particular injury. Somebody healthy, well, first of all, they're unlikely to show up with rotator cuff problems. But when they do, it's usually because they had a very high energy type of injury. Fell off from a ladder, they tried to grab the ladder to try to break the fall. Like a mechanism of injury that requires much more energy than for somebody who has diseased tissue affected by a lot of advanced glycation or products.
Because to wrap this question up, we're not focusing on the cause. We're not focusing on the environment. Most specialists in recovery don't do that. They just focus on symptoms and ignore the cause and the environment. This is what you're saying, right, Dr.
Correct.
Moreira?
Yeah, and I think that's, I'm an orthopedic surgeon, but ignoring the root cause of problems and just treating the symptoms, I think, is a systems-wide problem. It encompasses all of medicine. So for many specialties of medicine, it's the same problem, that we're treating symptoms without looking really into the root cause of the problem.
I know your opinion, Dr. Moreira, regarding arthritis and osteoporosis that are preventable. What is your opinion regarding healing them?
What was the first one that you mentioned? Osteoporosis and which else?
Arthritis.
Oh, arthritis, yeah, arthritis. I think osteoporosis is probably the most difficult one, at least without medication. Now, I'm not here as promoting the medication of osteoporosis. I do kind of have my suspicions about them. But osteoporosis involves a lot of just poor health decisions over many, many, many years, that once they get to the point where they have a fracture due to osteoporosis, in order to come out of that osteoporosis to bring the bone back to health is difficult. I found it in my clinical practice that it's not easy. Can it be done? Yes. There are people, I know of people in social media who have reversed their osteoporosis without having to resort to medications, to the bisphosphonates or any of those medications, but it's difficult. The arthritis, I think it's a little easier to relieve the symptoms. People who may go on a low carbohydrate diet, cut out the processed foods, cut out vegetable oils, I think they can see fair amount of symptom improvement in a matter of weeks to a few months. The osteoporosis, I think it does take more work. Now, there are medications that help with the bone density. The best class, the class that is best known is the bisphosphonates. But they work by inhibiting the osteoclast cells, which are the cells that remove the bone, that destroy the bone. Which initially it's okay, because then the only cells that you have working on the bone are the cells that build the bone, not the ones that remove the bone. But over the long term, it can lead to problems. Imagine for a second that you have a road and that you initially have potholes. Well, if you have potholes on your road, you can just fill out those potholes. But it gets to the point where you have so many potholes that the only way to improve the road is to completely remove the road and just lay out new pavement. Well, in people who are in bisphosphonates, you can't do that because they don't really have the cells now that remove the road in the first place. So the bone density may go up, but the quality of the bone is not as good. So if you have a patient with this amount of bone density who's never taken medication such as alendronate, or one of these other bisphosphonates, and then you have somebody who has taken them and they have the same bone density, the one who's never taken the medication is going to have a better quality bone because the bone will be less brittle. And it's not going to be basically a bunch of little cracks that are just patched up with new bone. You need to sometimes just remove the bone to lay out healthier bone. Having said that, though, those medications can help decrease the incidence of fractures. There have been about 3 bisphosphonates that have decreased the fracture incidence for wrist and for the spine and for the hip. But the data on whether they actually lead to a decreased all-cause mortality is controversial. And I have found studies that have different opinions or different conclusions in regards to that. So, but I do think, in summary, I think it's easier to relieve pain of arthritis through diet than it is to reverse osteoporosis through diet and exercise. That one takes longer period of time.
Also, from what I know, taking biphosphonates also complicates things, like if you need to do dental work, you're in a big trouble.
Yeah, you know, one of the rare but severe complications is osteonecrosis of the jaw. So people can have just osteonecrosis, which is basically bone death. The bone dies in the jaw. And yes, if people who have to have dental work or dental implants, so that could be certainly an issue. Other things that can happen for people who are in prolonged biphosphonates, they can have fractures that are usually due to the medication, because you're not able to remodel the bone. Then little microscopic cracks are not able to be healed properly. And so in patients that have been on these for like 5 or 7 years, they can have, you know, what we call atypical femoral fractures, which is a fracture on the femur that occurs usually tends to occur a little bit more distal than the hip. And I've taken care of these. Okay, so I had a patient who was in biphosphonate for many years and had the typical atypical femoral fracture location and everything, and you know, radiographic appearance. So it can happen, you know. And the early generation of these medications, what they were doing was inducing apoptosis, or what is better known as, you know, programmed cell death of the osteoclast, which kind of makes me think, you know, do I really want to induce death on a cell that is supposed to be there? So now the newer generations may not do that, but I'm still kind of a little bit skeptical, because I'm concerned that at some point we might find a new side effect or adverse reaction that perhaps we were not aware of initially. So I think I think they have their place temporarily. Much better to just fix diet and lifestyle in order to reverse the root cause of osteoporosis.
Yeah, I believe it's crazy to rely on synthetic drugs that, and we truly believe that long term does not have consequences. I was a professional basketball player, and for 10-15 years, and I would eat junk food, fast food, and all processed foods. I would twist my ankles regularly, like once every 2-3 months, just by walking in the city or running in the nature. In the last couple of years, because I'm really conscious about food and nutrition, I didn't I didn't twist my ankle, not even once. From your medical experience, can you explain this?
To not twist your ankle once you have improved your, I mean, I guess it could be several different factors. I mean, it could be the shoe wear, it could be the type of ground where maybe when you were running. I used to have more ankle twists when I was doing trail running, but when my nutrition was not as good though. So yeah. Is it the fact that I quit trail running, or is it the fact that I improved my nutrition? Probably mostly that, not running on a trail anymore with rocks and everywhere, but nutrition can have an impact too. Collagen is just slow to, I should say ligaments and tendons are a little bit slower to heal. I think they tend to be more slow to react to changes in the environment. And I think the perfect example of that can be novice or like rookie rock climbers. rookie rock climbers, they're now all of a sudden they're using their fingers all the time for rock climbing, and they haven't even given enough time for the tendons to get stronger or the ligaments to get stronger, and then they start getting injuries of like flexor tendon injuries and things like that. And so I think that's a perfect example of like a change in lifestyle that happens too quickly that the body is not able to catch up with. But I do think that nutrition will have a role in it, particularly if one has been already on an improved diet with adequate or optimal amounts of protein, that it can lead to stronger ligaments and tendons. I'm not sure that I've seen a paper that addresses that question in that way, looking at the strength of tendons based on nutrition. But we do have literature showing that the bones are better, that the wounds heal better or faster, you know, in patients who have an omnivorous type of diet versus a vegan type of diet. And so it leads to believe, though, that it can also make a difference on the tensile strength of ligaments and tendons. But I have yet to see a study that will look at that particular question.